Hey guys, today we are going to talk about the diabetes ketoacidosis. It is a condition where the sugar value in the body is more than 300 milligram per deciliter. It is due to the severe insulin deficiency. It is most commonly seen in type 1 diabetes mellitus. In this condition, there will be the formation of ketone bodies. How the ketone bodies are formed, let's see. As we all know that the cell requires glucose for its function, but in this condition the body means the in the blood there is lot of sugar, but the cell is not even able to take the glucose due to the insulin deficiency. So what happened next? The adipose tissue come in the picture, which shows that there will be increase in the lipolysis, which causes the triglycerides to convert into the free fatty acid. Now this free fatty acid comes in the blood, and through the blood it will move to the liver, where the acyl coenzyme A then convert into the acetyl coenzyme A through the beta oxidation. Now, these acyl coenzyme A will convert into the ketone bodies, which are acetoacetate, acetate, and the beta hydroxybutyrate. The acetoacetate will continuously convert into the acetate. Acetate will produces the fruity smell, and beta hydroxybutyrate found in the large amount in the blood and the urine. From all these above things, the counter-regulatory hormones will also increases, which are the cortisols, growth hormones, and the glucagon. These three will actually causes the increase in the sugar level. So there will be again increase in the sugar level. Now we can see the causes. Due to any infections or any other injury, the demand of the body for the glucose increases. Due to this, it will causes the insulin deficiency. Cocaine, mild or severe surgery, they causes the increase in the steroids, which causes the increase in the sugar level. Or third, we can say if the diabetic patient, is not even taking insulin as the body requires. Now let's talk about the clinical picture. How the patient will arrive. The patient will have the fruity breath smell. He will have the tachycardia and the tachypnea. Now let's see how the tachypnea is occurring. Actually, there will be so many protons will be formed in the body. So for the protons forming in the body, it has to be bind with the bicarbonate. So it will bind to the bicarbonate, it will form the carbonic acid. Now carbonic acid will break down to form the CO2 and H2. Now this, there will be so much of CO2 will be produced because there are so many protons in the body which are formed, and it has to combine with the bicarbonates. So there will be so much of CO2, so that's why body tries to release the CO2 from the body. That is there will be tachypnea. Okay, so next there will be vomiting and the nausea, because these ketones body which is present in the blood, it will activate the chemoreceptors and causes the vomiting and nausea. So that's why there will be epigastric pains also. In the examination, how we can see that there is ketones in the body, we can check the plasma beta hydroxybutyrate, which will give us the confirmation, and we can check the random blood sugar test, which will be more than 300 milligram per deciliter. We can check in the urine test the ketone bodies are formed or not, and then we can see the plasma osmolarity, which is more than the normal value. Normal value is 275 to 295. It will be more than the normal value. Then we can see there will be increase in the BP. It can be increased or it cannot be. If it is increased, it may be due to the sympathetic activation. It is, if it is depressed, then it will be due to the dehydration component. The patient will be lethargic or obtundation, because there is so many sugar, but the cell is actually starving at that point. Cell do not have the glucose for its function, so that's why the patient will be lethargic. We can also see the other finding also. There will be increase in the potassium value in the blood, because insulin also have one activity, it causes the potassium to go into the cell, but in this condition insulin value is very less, so that's why there will be increase in the potassium in the blood. Sodium value may be low or it may be normal, because low, as there will be the sugar component which causes the water to come outside the cell and into the blood, which causes the dilution component. So there will be the hyponatremia, and due to the water coming out of the cell and causing the hypertonicity. So there will be the hypertonic hyponatremia condition. There will be hyperlipidemia, because free fatty acids are coming out from the adipose tissue. There will be the high anion gap, Normal value is less than the 12, but it will be more than 12 in this condition. Now let's talk about the management component. There will be so much of dehydration component as there is polyuria, polydipsia. So we have to manage the dehydration component. It can be more than 5 liter to 9 liters. So we have to manage the dehydration component by giving the normal saline IV, and then we have to give the regular insulin because there is a problem in the insulin deficiency. Regular insulin we have to give, which is 0.15 international units per kg per hour, and then we have to give the maintenance dose, which is zero point 0.1 international units per kg per hour. We can also give the potassium chloride and the normal saline. Let's see that if potassium value is less than the 3.5 milliequivalent, then don't give the insulin, because we know that the insulin causes the potassium to go inside the cell. And in this condition, if there is the value is less than the 3.5, the potassium value will go again inside the cell, so there will be the hypokalemia component which will occur, so which will worsen the case. So that's all.